Hi, this is Trisha Wonderly with Dental Hygiene Excellence, and I want to talk about how we hand our patient off from the clinical side to the administrative side. 4 goals to keep in mind would be we want to make sure we're consistent. We also want to be prepared so that our treatment coordinator and our patients aren't becoming flustered by us running around trying to gather the information we still need. We want to be conscious as well, conscious of whether or not the treatment coordinator has the time to sit down and review what treatment needs to be done in case they're with another patient or on a phone call. Also, we want to be conscious of the amount of time that our patient has actually already spent with us. So let's just have some conversation around that if we're going into their time, their appointment time for a longer amount of time than they had expected, just to have some conversation to make sure that they do have a few extra minutes to talk to the treatment coordinator. And lastly, let's just be courteous. These patients are going through a lot and going to be presented with some treatment, and they need to make some financial decisions, and we don't want them to feel rushed. We just want them to know that we are here for them. So with a smile and a warm handshake, make sure that you are always passing off your patient to the treatment coordinator so that they feel like they are really valuable and that we really consider their time with us a privilege. If your patient does not have any restorative needs that have to be scheduled, depending on how your office does it, you can walk your patient personally to the treatment coordinator. Introduce the treatment coordinator if they have not met already, and if they have, it still would be a good idea to repeat their name so that there's a familiarity with that patient and the person that they're going to be scheduling with for either their follow-up hygiene visit or at least making a payment for today's appointment that took place, or at least getting a receipt of what happened during their appointment with us today. If you didn't schedule for your next hygiene visit, please let the treatment coordinator know that at that time so it can be scheduled. And at this point in time, if it feels comfortable, you want to make sure you ask for a referral if you haven't done it already in your room, and always be sure you thank your patient for taking the time to be with us. If your patient does have restorative needs, you want to do the same as the frame above, where we talked about walking your patient up, introducing them, letting them know if you need a hygiene visit scheduled, asking for a referral, and thanking your patient. But in addition to those things, you want to make sure that when you bring your patient to the treatment coordinator, you have photos either up on the computer monitor or printed for your patient and the treatment coordinator to see. You're going to state to the treatment coordinator while the patient is sitting with you what the problem is, pointing to the areas of concern. The problem is, and then state to the treatment coordinator the consequence. Something along the lines of, the patient now knows that we've discussed the consequence of not treating this would be, and then give the consequence that you had shared with the patient. And lastly, state to the treatment coordinator what solution you've discussed. So you can say, we have already discussed the solution of either therapy or a crown or whatever it was. And that way the patient is being acknowledged for the fact that they've been told this, but they do need to hear this 5 times for them to really have an understanding of what it is we're recommending. So this is the 4th time that they'll be doing that when you're giving this information to your treatment coordinator. And the whole time you're having this conversation with the treatment coordinator, you want to make sure you're continuing to be an advocate for your patient. So when you've finished giving the problem, consequence, and solution, also turn to your patient and say, what questions do you have for me about your appointment before I let him or her take it from here and get you scheduled? And once they've answered that, just let them know. Say, please know that I'm here for you as your patient advocate. So if you have any questions at all, please feel free to contact me. At this point in time, if I haven't done this already, I would have 2 of my business cards available and just say, here's my card for your convenience if you would like to contact me at all. In fact, would you do me a favor? Let them answer. If you have a family member or a friend who you believe would appreciate the same quality of care that you received today, would you mind giving them my contact information? And then hand them a second card. And just tell them, I loved taking care of you today. And usually it's people like you who have quality friends and family members that I'd be privileged to take excellent care of as well. And then you want to turn things over completely to your treatment coordinator and promote your treatment coordinator by saying something like, at this time, I will leave you with whoever the person's name is. They are very capable to take care of you, and I'm going to just leave you in their capable hands to have an excellent appointment from here on out. If you have any questions, please let me know. And then lastly, thank them. Thank you for coming in today. And I would share this with them. Tell them that we know there are many dental offices that people can choose from, and we don't take that for granted. So I really appreciate your trust in me, and I look forward to our next visit together. At that point, with a smile, shake their hands, or if it's appropriate, give them a hug. And that is your handoff.